Celiac disease is an autoimmune disorder that affects the small intestine. It's triggered by gluten, which is the protein found in wheat, barley, and rye. And as a result, the small intestine gets damaged, and this leads to the different manifestations of celiac disease. Celiac disease occurs in people that have a genetic predisposition. It generally can't start until you're consuming gluten. So typically the earlier age of onset is like age 2 to 3, but can occur at any point in someone's life. So they can be an older adolescent, or it can be diagnosed in adulthood as well. When patients with celiac disease eat gluten, there is a wide variety of symptoms that can follow. Some patients remain completely asymptomatic. They wouldn't even know it if you didn't tell them it had gluten in it. Other patients can have mild symptoms ranging from, a little bit of abdominal discomfort or nausea to, severe abdominal pain, vomiting, diarrhea. It really varies both patient to patient and then with the dose of gluten that they consume. Some patients have non-gastrointestinal symptoms such as headaches or a particular type of rash. And sometimes there are other, even less specific symptoms like mood changes, irritability, and fatigue. Another presenting sign of celiac disease can be trouble with gaining weight and or getting taller. That is often how patients come to me, where they've either started to kind of fall off their weight curve or their height curve and their weight is still fine, and that will prompt pediatricians to send the celiac disease screening, which is a special antibody test, and if that's positive, then they get referred to a gastroenterologist. Some patients do have a sensitivity to gluten and don't have celiac disease, called non-celiac gluten sensitivity. These patients, typically if you checked the celiac labs, they would be normal. If you did a small intestinal biopsy, we would not see the same damage that we see in celiac disease. It's usually normal. But these patients do feel better if they're not eating gluten. If you have a sensitivity to gluten, but not celiac disease, and you eat gluten, you may feel bad, but it's not going to hurt you. Whereas in celiac disease, you really can have long-term harm over time if you continue eating gluten. Once you have a confirmed diagnosis of celiac disease, the recommendation is to adopt a strict, lifelong gluten-free diet. Right now, that's the only treatment available. There's hope that in the future there will be some treatments, but right now that is the only treatment. So as soon as the diagnosis is confirmed, we recommend they start that diet to the best of their ability, and then we always refer them to meet with a registered dietitian with expertise in celiac disease and the gluten-free diet to give them in-depth education on how to do a gluten-free diet.